Hi, hello, namaste, welcome back to our channel. My dear student, the today's special topic about the disorders of respiratory tract. As we know that every system, every human system is having normal and abnormal. If the living organism will be the normal, the system will be the normal. Sometimes, in some cases, in the clinical significance, we can able to find out some kind of the disorder. So within the respiratory system, the first disorder will be asthma. It is a common condition we can able to find out for individuals. So what is the meaning of here asthma? So you can see asthma is nothing but inflammation of the bronchial tube. So this is a diagram. So you can able to see here. So this is a normal tube and this is the asthma affected tube. So what is this tube? Before that you must understand. So this is the airway, so trachea and bronchus and lungs. So when this kind of the bronchus is it, so when the bronchus or bronchioles is going to narrowing, in such case the breathing problem will be happen. So inflammation may occur different kinds of the causes. The etiological pathological disorders will be the thing will be the top thing will be come smoking. So those who are smoking heavily, those things will be occur. So that is a inflammation of the bronchus, that is will be called as asthma. So what it is telling, it is a common condition we can able to find out within the human respiratory system. So what will happen, so when it is the muscle of the bronchi will be thickening. So when it is going to thicken, then asthma will be occur. You can see able to see here, so how it is wider. So here inhalation exhalation process will be normal, whereas when it is going to narrowing, when it is going to muscle will be thickening, so it leads to asthma. In the sense they can't able to give proper expression and inspiration, they can't able to give the proper breathing pattern. That will be called as one of the disorder is called as asthma. And next second disorder we can able to find out emphysema. So this is one of the clinical disorder we can able to find out within the respiratory system. So before going to discuss about emphysema, you must understand where the emphysema will be happen. Means where exactly the part is going to getting problem. As we know that, so within the respiratory system, the end part will be called as alveoli. So this is the grape-like structure you can able to find out here. So this is the parts will be called as alveoli. So you can able to see here, this is a healthy alveoli. So complete this picture you can able to find out healthy alveoli. Whereas it is unhealthy. So how it is going to indicates of unhealthy? Yeah. So you can see here, so why it is going to unhealthy, when it is the damaging due to some certain etiological pathological factors like smoking, alcohol, life changes, lifestyle changes. So this kind of the problems leads to the damaging of the air spaces, air sac, nothing but alveoli. So when the alveoli is going to damage completely, the disease will be called as emphysema. My dear students, you can find out when the alveoli is going to damage, the complete respiratory system will be damaged, because where the exchanging of the gases will be completely takes a place of air sac only, alveoli only. Once it is getting damaged, the respiratory system will be compulsory damage. So this is about the emphysema clinical disorder. Next we can able to find out pneumonia. So lot of the peoples will know, they will tell that what is the meaning of pneumonia, they don't know. But what is the meaning of here pneumonia? The same thing. So and the part of the respiratory system, that is the alveoli, that also called as air sacs. When the air sacs normal, the respiration will be normal. But when the air sac is filled with some sort of fluid, when it is going to fill with the fluid, in such case the diffusion or osmosis it won't be occur normally. The gases exchanging will be stopped. So in such case that will be called as pneumonia. Water accumulation in the part of alveoli, water accumulation in the air sac. In such case the gases exchange will be stopped. When it is gases exchange will be stopped, the respiration ultimately it is getting stopped. So that is the disease condition will be called as pneumonia. Next we can see lung abscess. In the medical terminology, abscess is nothing but pus collection. So when the pus collection will be happen wherever in our human body tissue, when the damaging of the cells, ultimately the tissue will be damaged. When the tissue is going to damage, ultimately the necrosis will be happen. Necrosis is nothing but damaging of the tissue. Death tissue is called as necrosis. So that is the thing we can able to find here. When the necrosis things will be happen within the lungs, then the pus collection, the abscess we can able to find out. The main reason for this, smoking only. So long time when the smokers is taking cigarettes or whatever it may be, so in such cases the abscess we can able to find out within the lung tissue, in that is called as lung abscess. That is one of the clinical disorder. Next we can see lung collapse. So you can able to see this side, right lung is the normal, whether it is structure is normal, anatomically, physiologically the pinkish color, everything is normal. We can able to find here left lung is a collapsed. When the lungs is collapsed, the air space will be short, the respiration will be the abnormal, so the person can't able to take the breathing, inhalation and expiration will be decreased. So this is the meaning of collapse. So when the lungs is collapsed, that disease condition will be called as lungs collapse. So respiration will be abnormal. So that is about collapse. And next one is apnea. So apnea, so as in our medical terminology, apnea is nothing but difficulty to take the breathing. So when the person is not able to take the breathing pattern, in such case that the problem is called as apnea. So you can see here the normal person lying position. So when the person is lying in the normally, when the flow of the air will be normal, so then the breathing will be normal. Whereas blocked airway, so this diagram is showing the airway will be narrowing. You can able to find here the airway will be narrowing. Yeah, so when it is the narrowing, he can't able to take the breathing properly. The exchanging of the inhalation and exhalation, so will be the normal. In such case, that will be called as apnea. Apnea is nothing but difficulty to take breathing. Inspiration, expiration will be abnormal. So that is called as apnea. Next disease condition we can able to see the lung tumors. Nothing but cancer. It is a very life threatening condition, very abnormal thing we can able to find out in the lungs, the cancer, life threatening condition. You can able to see here, this is a right lung is a complete normal, where you can see this is a carcinoma is nothing but cancer. So tumor is nothing but cancer. So whatever it may be, when the carcinoma is nothing but malignant is very dangerous cancer. So benign is there, malignant is there. Benign is there, normal, it's a tumor but it's not a harmful to the human body. Whereas carcinoma coming for the malignant is a very dangerous cancer. So that is the problem we can able to find here. This is the abnormal cancerous lung. So that is about the tumor, I mean lung cancer. So next one, so this is about lung cancer. So my dear students, so these are the things we have discussed today, that is the abnormalities of respiratory disorders. So this is the main abnormalities I have discussed today session. So this is the very helpful for your future exam point of view and competitive exam point of view also. So my dear student, so this is about the complete session about the respiratory disorders. I will come for next session with new topics. Until that, stay tuned. Please like our channel, share and comment and subscribe. Until that, stay tuned.